So good afternoon, everyone, and welcome to Business as Usual. This may be a hump day, but this is a hot topic that we're going to talk about today. I'm Audrey Russo, President and CEO of the Pittsburgh Technology Council, and I'm joined here today with Jonathan Kirsting, who's Vice President of all things media and marketing. We are thrilled to have this conversation today. Thrilled probably isn't the exact word because the topic is so important and it affects each and every one of us. So I am going to just set the table and thank our sponsors. That's Huntington, Deloitte, and Sheets. They've believed in us. Huntington has believed in us right from the beginning. Deloitte has worked in the innovation community for a really long time. And Sheets has been very, very active in the Pittsburgh community, not just in addition to their stores, but they also have an innovation center and they're working on the future. So tremendous partners, companies that you should get to know because they're integral to the fabric of our region. And I also just want to tell everyone that we've muted your microphones only with the intent that we don't hear anything in the background. And we also want to make sure that we have a chat, and the chat is there for you to ask questions of our guests. Jonathan will monitor that and make sure that the questions get asked accordingly. But also we want to make sure that this isn't an opportunity for you to sell your wares. That's not what this is about today. So I am going to jump right in. I want to make sure that we have plenty of time to have this conversation just like we do each and every day. And I am pretty thrilled by the guests that we have here today. First, we have Nick Vizzoca. He's the president and CEO of Vincentian Collaborative System. And we also are joined by Nancy Zionts. She's the COO, Chief Operating Officer, and Chief Program Officer of the Jewish Healthcare Foundation. We have two people here that have spent an enormous amount of time in what we're going to talk about in terms of long-term care. So if you saw on our invite, we talked about assisted living. We're really talking about all of long care. So I'm very happy to have this conversation because it's timely, it is important, and it affects all of us. And when I say it affects all of us, if you've heard any of our shows before, you know that we've talked about the issues in terms of healthcare. But the issues that are affecting communal living have been a huge sore spot for our entire community. So when you think about the people who are working in these environments and the people who are living in these environments, these are our most vulnerable population, but they affect each and every one of us in terms of what it means for COVID in our region and what it means in terms of how we treat people who are most vulnerable, and in addition to their employees. We have been active at the state level trying to make sure that the resources are pointed so that the community environments, long-term care environments can get the support that they really need. But if you look even at today's paper, on the Post-Gazette, you can see that we still have troubling times all around us across the state of Pennsylvania. That is my rant for now. If you ever want to talk to me about it again, you know where to find me. But I am going to pass the baton to these two individuals who spend their work and their time doing work that many of us do not either understand, haven't been touched by directly, but really need to know. So I'm going to kick it off. We have Nick. Nick, come to the forefront. And I mentioned that he is here with us from Vincentian Collaborative, and he runs the operations, and I want to introduce Nick. So Nick, thank you for joining us today. Really appreciate you being here. So just set the stage, tell everyone what you do, and what are the big issues that you're facing.
Yeah, thank you, Audrey, and thank you, everyone, for having me. Yeah, these are definitely difficult times. So as Audrey said, I run Vincentian Collaborative System. We oversee almost 450 skilled beds, personal care, independent living. We also have childcare. So we run the gamut from, as we say, cradle to grave, right? So we have it all. And it's definitely something challenging, but what I will tell you is, when I took this position and assembled a team, I'm not interested in making the trains run on time. I'm interested in using different trains and changing this industry and turning it on its head, because for so many years, it's been neglected and it's not been paid attention to. And everybody wants to pay attention to it when, the proverbial shit hits the fan and things go wrong. And that's when, that's not right. We've gone too long neglecting this industry. And I'm here to tell you with my team and with others that we're going to change the way we do things going forward. So thank you, Audrey, for having me. I look forward to this.
Thank you. And then I'm going to pass the baton really quickly to Nancy Zionts. And I mentioned earlier, she's the Chief Operating Officer and Chief Program Officer of the Jewish Healthcare Foundation. So thank you for being us. Hi, Nancy.
Hi.
And, let's talk about what you're up to, what you do, and what you oversee.
Perfect. So many of you know the Jewish Healthcare Foundation. Karen Feinstein and I were privileged to be on this program a few months ago, actually discussing this topic and others. And the foundation doesn't just focus on issues of aging and long-term care. We also have agendas that overlap in patient safety, in women's health, HIV/AIDS, adolescent behavioral health, and a whole host of other programs. But I've been with the foundation, this is my 26th year, and I've always had the privilege of being able to manage a strong aging and long-term care team. We're very focused on everything from advocacy to engagement of seniors to the provision of care at the front line. And we are always focused on how do we provide the support that the workforce in long-term care deserves to have in order to take care of our most vulnerable residents in our region.
Okay, thank you. Thanks for joining us today. So Nick, we're going to go back to Nick as someone who's leading this massive operations. What are some of the biggest issues? And we're going to talk about, let's talk about COVID, obviously. What are the biggest issues that you are facing as a leader of, the Vincentian Collaborative in terms of COVID and because of long-term care?
Yeah, I think I'll start with long-term care first, Audrey, right? I think this is an issue that's been plaguing this industry for well before COVID. We realize there's, funding issues in terms of reimbursement from Medicaid. And I know you and I have talked about this. As a faith-based nonprofit, our focus is our mission, and we're not bottom line driven, we're mission driven. I have 68% of our skilled residents who are on Medicaid. So before COVID even started, there was an issue, there was a problem. There was a problem that, it costs more for me to care for a resident on Medicaid than it does, than I can pay out, right? So there's a staffing issue. Let's get down to that first. Being faith-based, and there's 10 of us nonprofits, you look around this region and you see a lot of for-profits coming in, and these for-profits will cherry pick and they'll take what they want. When the money runs out, then I get them, or the folks at these nonprofits get them, because you know what? We don't turn anybody away. That's our mission. That's what we do. And then COVID hits, and now all of a sudden everybody wants to bring attention to this. Right now it's a problem. But I will tell you that I'm blessed with a team that's incredible here at Vincentian. We created a clinical excellence team, and before there was even the initiative to shut things down, back in February, this team had the foresight to sit down and create 2 15-bed COVID units in our North Hills. We thought that was going to be used for our own residents. We thought, if a resident tests positive, we've got these 2 units we've just created, and they're negative air pressure, isolation units, marked off from anywhere else on the campus. We won't mix. We've had over 30 residents pass through those units, and not one has been one of our own. We've accepted COVID positive patients from hospitals, from other facilities, and allowed them to recover. And the sad part is, Audrey, none of them want to go back to their facilities. They don't want to go back to the Brightons of the world. And these are problems that existed before COVID. So let's get this straight. Like, you should have fixed this. The state and the DOH, DHS, everybody, you should have been on this years and years ago, but you sweep this senior sector under the rug. And I'm here to tell you, like I said, my team and I, and I know Nancy and JHF is focused on this. The time for talk is over. We need action. We need doers. We need doers to step up to the plate. So let's do it.
So Nancy,
Yes.
Talk about what this new collaborative is, or this coalition that's been formed.
Sure. So the first thing I want to say is just to level set for people in terms of the statistics. 90% of the deaths of people with COVID are over the age of 60. And that accounts for 70% of all of the Allegheny County deaths are from long-term care facilities. So lest we think this is a small problem, this is a huge problem. And it is impacting a certain sector of our community much greater than other sectors of the community, but it impacts all of us. Mm-hmm. These are our neighbors, these are our parents, these are our grandparents, and these are people that we need to make sure that we are able to address their needs on an ongoing basis. Mm-hmm. And
these are our friends too.
These
that
are our
work in
friends.
Facility.
These are the people who built our community. When you think of their ages, these are the people who built our community, who took Pittsburgh from where it was to where it is now. And it's not just that we owe them, they are a part of us, and it seems natural that we would give back to them. And I want to say that this particular group and this business as usual call is behind a lot of what we're seeing now coming out of the state. For example, when you had us on a few months ago, you allowed us to get fired up and ask people to advocate on behalf of this sector. And I want to tell you that the program that was just funded now out of the state, which is called the Regional Response Health Collaboratives, is a direct result of that advocacy. It's a direct result of people saying, we are not doing well by our seniors. We need to put money behind this. We need to put the best minds to go in with infection control protocols, to go in with appropriate, reliable, timely testing, so we can really get control of this virus, because the virus has control of us now. So these regional response teams are bringing together the best of the academic medical centers and other health centers from across the state, working collaboratively, assigned to facilities to go in and do what we asked for. Do some rapid response, go in and find out what they're missing, provide them with the assistance they need on a daily basis. And I'm incredibly proud to be partnering in the Western part. We're partnering across the state with a learning network, but incredibly proud to be partnering in the Western part of the state, the best collaboration between UPMC and Allegheny Health Network. This is a time when our community said, step up, do this together, and they have stepped up to do this together. So there's a lot of work, and it's a horror story of what's going on in skilled nursing, but we are trying to put the best foot forward with the best resources in collaboration.
Okay, so I'm going to jump back to Nick, and I'm going to talk about the realities of day-to-day.
Yeah.
Let's talk about day-to-day. Let's talk about the things that you and I talked about, from, you know, having the right equipment and testing and the process, et cetera, so that people can understand the snapshot of what it is that's going on each and every day.
Yeah, so, and I agree with Nancy. I think it's well-intentioned what this regional collaborative is setting out to do. But I also have to say that, you know, when you put together these 7 academic institutions across the state to create infection protocol and create processes, you know, I'd ask the question, did anybody ask us? Did anybody ask the people who are living this every day? And I get it. I understand, you know, AHN, UPMC, and a lot of large organizations that they mean well.
Right.
But the fact of the matter is, I still can't get testing. And I'm testing right now, and I will tell you that Quest has a backlog of over 25,000 tests. So I have to wait 17 days to get a result. 17 days. Well, I will tell you, one of 3 things will happen in 17 days. Either 1, that person will pass away. 2, they'll recover. Or 3, they're going to end up in the hospital, and now I've infected my entire facility. So that, I think, is an issue. But, you know, you hear a lot of rapid testing. I can tell you, you could send an employee right now to an emergency room, and they will get rapid testing. Within 40 minutes, they'll get results. Why can't I have that?
Right.
That's what I need in our facilities. I can't wait 2 weeks. I can't. It has to be right now, real time. So all this talk is great, but it's going to come too late.
So I couldn't agree with you more. So these were only literally conceived of in June, and literally are just being stood up now. I can tell you, I don't know of one rapid response team that has yet been able to deploy out to a facility, because they still don't even have their contracts from the state, and it's not their fault. This is something that the state came up with, and the infrastructure for any of you on this call of getting something through government is very complicated. I will tell you that I do think that some of the best clinical people are being put on this, but testing. We don't have across this state adequate supplies, the adequate reagents. We don't have reliable tests. If 50% of it is, if a test has a 50% reliability, it has a 0% reliability, in my opinion. And if the turnaround time is anything over 72 hours, I couldn't agree with you more. You may as well throw it out. If by the time you're finished testing the second unit, the first unit has been reinfected. And this is coming from the outside. So one of the things that I think is really critical for everybody on this call to understand is, you may not step in a skilled nursing facility ever, but your behavior impacts what is going to happen in that skilled nursing facility in this county and others. You're wearing a mask, you're social distancing, you're making sure that you're washing your hands and that you're not going out for almost anything will keep people in skilled nursing facilities safe, because the staff that Nick has to put out there every single day has to go home, has to go to the grocery store, has to go to the pharmacy, has to take care of their family. We need to give them the full lane to do that, not surrounded by those of us who may or may not be practicing the best socially responsible behaviors. That's on all of us.
So let's go back to Nick. Thank you, Nancy, for that. And that's what I was trying to set the table early on, is saying why this is so important for all of us. But now I'm trying to teeter back and forth in terms of reality. So here's Nick running this operation, trying to keep everyone safe, trying to make sure that he's accommodating. What about protective equipment? What's the status of that, Nick?
Yeah, so early on in this, we were fortunate enough to stock up. I will tell you, I was the guy at Home Depot at midnight when the trailer came in and trying to buy whatever I could. It felt like I was buying stuff off the black market, right? and I think we need to continue to do that. But Nancy brings up a great point. You go out and it's selfish not to wear a mask. It's selfish not because you are affecting everybody else. And I will tell you, in 2 to 3 weeks, if these school districts reopen, it's going to get real. It's going to get real, because I'm telling you, these kids are going to go to school and they're going to come back, whether it's a hybrid or a full day, and they're asymptomatic, right? And they're going to give it to mom, or they're going to give it to dad, or they could potentially, when they go to the grocery store, they may run into one of my employees. So I think that once fall hits, this is going to become even more critical, to Nancy's point, that this testing has to be rapid. This PPE has to be available. And I'm not interested in those facilities that can't get their act straight and have an infection prevention protocol already in place. I don't need this collaborative to come in and tell me how to do infection prevention. I know how to do that. You should know how to do that if you're in this business. If you don't, you should have your license taken away. This collaborative needs to help us with staffing, because unlike the big health systems that here in Western Pennsylvania, we've been fortunate. We haven't seen what happened in New York City or in other places across the country. And a lot of these health facilities and hospitals have been laying nurses off because there's no volume. And we don't have the staff. I can't get staff. I have to go to agency. And now you're introducing new people in. Staffing is an issue. I need help with staffing from the regional collaborative. I need help with testing. I need help with resources in terms of getting the PPE. That's where the help is. I don't need to understand that, hey, you've got documentation on infection prevention. Yes, we've had that for years. That's what you should be doing.
Nick, let me clarify a little bit here, because these are not people coming in from the Department of Health, and they're not coming in to regulate you, and they're not coming in to report on you. So this program is completely voluntary. Your facility's participation in this program is completely up to you. And you can also pick and choose what parts of this program matter to you. So let's be really clear. Nick's facility is like none other. There are some excellent facilities in our region, and then we know that there are some others at the other end of the spectrum. So I think it's really important to know that everybody is going to need something different from these regional collaboratives, and you need to articulate to them what you need. And if it is staffing, push the staffing button. You don't need them to come in and teach you about infection control. You could teach others, and I'll call on you to teach others, but you need to get them in for staffing, and you need to get them in potentially to help you deal with protocols of what do you do with patients who don't want to return back to their home facilities. So you don't have to have them come in and do infection control. But boy, aren't there facilities out there, Nick, that you want to have experts go in and do infection control for? So
well, I think not only do the infection control, but I think it's up to the state, Nance, right, to also say it's time for these places to be shut down. It's been long enough, right? But so you brought up a good point. If it is, and it is staffing, and I will say I'd raise my hand and say staffing. But the answer is not, well, here's 2 phone numbers to staffing agencies. Go call them and good luck. No, I need you to help me. I need you to deploy staff to me, at least for this short period of time. Look, we've been very fortunate by the grace of God, and I tell you that our sisters pray for us all the time, and this is why we don't have any negative residents. But I'm not going to fool myself either. You know, things can change on a dime. We've seen it happen, and an outbreak can occur in my facility. But I'd like to think that our staff and our residents and our employees are as you said, they're one in a million. I mean, and I would put them up against anybody. And I've worked at the great organizations in this region. I've worked for Highmark, and I've worked at UPMC. And I'm telling you, this clinical team that I have here at Vincentian is incredible. And you're right, Nancy, but it's a focus, and it starts at the top. And leaders have to lead. I'm not going to manage this. I don't manage it every day. I need to give my team the resources that they need to go out and do it. But they also need to bring. I am extremely grateful for the regional collaborative. I am, because you're absolutely right. If one of us fails, we all fail.
Right.
Because as you see in the news, and whether it's in the Post-Gazette or on KDKA or whatever news outlet, when one facility goes up, we're all lumped into that.
Right.
We're all horrible.
So one of the things that we learned, Nick, in the early part of the spring when we were helping to provide education and training for personal care assisted living facilities, and some of these clinical providers were having call-in hours for them to help them, we found out that the breadth of skill in these facilities, it runs the gamut from 0 to 100, some of them I'd say minus. And the ability to reach out, this is probably the first time that they've had coordinated attempt to get them the resources that they need. This does not take away from the initial part of this conversation. There's something to be done here for COVID, but if COVID were to magically disappear tomorrow, this conversation needs to continue.
Right.
We need to be,
Absolutely.
as a region, committed to only having facilities that are of high quality, that deliver high quality, that are committed to improving themselves, and they can only do that if they are staffed appropriately, and that can only happen if they are paid appropriately.
That's right,
And
Nancy.
this all goes right back up to what is the policy that overlies all of this. We are now realizing that we should pay people hero pay. I'm going to tell you, I don't know when we should ever stop paying them hero pay.
You're right.
And that, to me, if we can find the money to do it short term, it's a recognition of the fact that we should have had that money placed here long term and for the long term.
You're absolutely right, Nancy. Let me ask you this, and I'd ask anybody on this call this. What do you think is going to happen here in 2 months when the flu reemerges? Right? How are we now going to figure out whether you've got COVID or you've got the flu or you've got this or you've got, and I agree with you, Nancy, that the hazard pay, that's wonderful. But I will tell you, and no, I'm not taking anything away from hospital nurses and doctors, because they're fantastic. And I think what they do is great. But my nurses, I will challenge anybody, come and do what these folks do in these nursing homes for one day, and you'll leave running on what they get paid. They deserve to be paid double what they get paid, if not triple. They are the true frontline heroes in this battle.
So the irony is we'd like to take everybody in and show them the work these people are doing. And we are at a time when these facilities must be locked down completely. Right. And as painful as that is for some of us who are worried about the isolation of seniors, it is incredibly painful to know that families haven't seen family members, and to try to find creative ways to connect them. Technology has been a godsend to these facilities, whether that's using FaceTime or whether it's connecting them using Zoom, or whether it's doing 2 telephones across a glass so that they can meet with people. That has been wonderful, but we're not going to be able to do those sorts of distance visits in the winter, right? So we're going to have to find new technology that will allow us to bring the outside in while leaving the virus on the outside. That's going to be really, really critical going forward, because we are not going to be able to just turn a switch and say, we're going back to the way it was, because frankly, the way it wasn't the way it should be in the future anyways. No. Long-term care needs a complete overhaul. We need new facilities that meet the needs of seniors, that are safe and that are respectful of their workforce.
So will this work address something that Nick's mentioned, and I see someone's brought it up, I'm going to sort of paraphrase it, that other states, their Medicaid rates are almost double that of Pennsylvania. Is that in fact true? And is it in fact true that PA has not raised the Medicaid reimbursement for like many, many years?
7 years, Audrey.
7 years.
7 years. So will there be some focus on this, Nancy, in the collaborative? Is there?
So it's very funny, not so much funny, but before COVID, this was an area that we were very, very focused on as a foundation. We were focused on it with people like Nick and with Presbyterian Senior Care and the Jewish Association on Aging. We have been focused on doing right now, working with Leading Age UMass to do the case for funding for long-term care in Pennsylvania. The case is easy to make. finding that funding is not that easy to do, but the case is easy to make. We can see that we are not adequately paying or staffing. Nick, do you want to jump in?
Yeah, Nancy, I agree with you. I've gone to Harrisburg and I've lobbied and with some great people, and right, the funding goes elsewhere. So my point to them was, great, the funding will go elsewhere. Let's sit down and figure out an innovative way to do this. I don't want to come to Harrisburg every year with my handout saying, I need another 2%. I need another 2%. That's crap. Like I'm saying,
an overhaul.
That we need a complete overhaul. This system is fractured. It is broken. It is broken. When most folks are going to personal care and they're paying $5,000, $6,000, $7,000 a month, private pay without any help from the government, and then their funding runs out. And now they've got to come and live with one of our facilities, and they could potentially be there for 10 years. And you're losing $100 to $200 a day, depending on the condition of that resident. Over 10 years, that's a lot of money, right? But what I'm saying is, let's sit down and figure out an innovative model. Let's figure out a way to say, look, not everybody qualifies for Medicaid. And I think, Nancy, you brought it up. We owe it to the people of this region. The largest chunk of the people in this region are the middle class. And those are the people like my mother and my father, who my father was a Port Authority bus driver and he served this county well. And my mother was a stay-at-home mom. But you've got people on this end of the spectrum that are wealthy. They don't care. They don't need it. They're going to pay for it. Then you've got people on this end that go, well, I depleted everything. I'm on Medicaid. Medicaid will pay for it. Where that large chunk in the middle says, I'm crap out of luck because I don't know what to do. I don't qualify for Medicaid and I don't have enough money to go into these facilities. I'm stuck, right? So is there a way to maybe be innovative and say, instead of spending our money on Medicaid, which is hundreds of millions of dollars a year, should we be reimbursing some of these people for personal care and bring the services to them into those facilities? Bring the home health there and let them age in place, truly age in place. We just built an independent living facility in the North Hills, and we leverage technology. We worked with K4 Connect out of North Carolina. That place is a smart building. So those people can age in place. That should be their last stop. You shouldn't have to go from independent living, then to personal care, and then to skilled, and then to stay here. We'll bring the services to you.
And other countries have done this better. I've spoken to Audrey about, let's try to use a forum like this to bring in best practice from around the world. Let's try to look at what could be innovative in how we give our seniors, whether it is 5 years or 40 years of their life, what should it look like? What should living look like? What should maximizing, we call them the golden years. We owe it to people to make sure that these are satisfying years. And it probably in some cases will cost a little more, and in other cases there'll be a lot of savings, but there isn't a lot of good planning going into it in this country and not in this state, and there's an opportunity to do so.
Yeah, no, Nancy, I couldn't agree more, and this is one of the reasons why I've got 5 college students living with our seniors in the North Hills, and soon to be in the next week, 16 graduate students from Chatham University that are going to move into a personal care facility at Shenley Gardens. Like, let's start to, and to Nancy's point, that wasn't something that we took from a best practice here in the US. It came from Belgium. It came from the Netherlands. And and I agree with you. I'm done. We're going to look elsewhere. I'm looking at other industries. I'm looking at unlike industries. So if anybody's on this call, you want to talk to me, you reach out, because I want to be different. I don't want to talk to other senior operators. I want to talk to other industries.
So in terms of technology and in terms of the tech community here, obviously we have a platform, we are continuing this dialogue. How do we help? How do we help in a concrete way?
I would ask in a few areas. Part is we're going to need help in continuing telehealth, which is now not going to go away after COVID, which is terrific. People can age in place and get care that they need. We need strategies to reduce isolation. I think that's going to be really important. And then we need creative minds to work with people who understand seniors, people who provide long-term care, and architects and designers to try to design new types of facilities and living arrangements that can be offered to various people. Let's try that out in the tech world. Let's figure out what those can look like and be configured. And I think that would be a great bringing together of a range of different industries.
And Nick, what can we do for you? What can we do for Vincentian Collaborative?
Yeah, I think the biggest thing that's already been done for us is we've implemented Kuravi, which is telehealth, through all of our facilities, and it's been a
Right.
godsend. It's been a godsend because these residents don't have to go out. But the screening technologies, that are out there to help before folks even come into our facilities, how do we screen them and make sure that they don't have, I cannot tell you how many folks, agency workers have showed up at our door with a fever, and we have to turn them away. So is there a way to work with these tech companies? And listen, we've got a lot of bright minds in this region. It's not meds and eds for no reason. And whether it's Carnegie Mellon or the University of Pittsburgh, there's some bright people out there. So is there a way, and Nancy's right, this is not going to go away. Whether a vaccine comes out or not, this is going to be with us for a while. But is there a way to virtually connect these seniors other than just maybe an iPad or a FaceTime? Is there a way to connect them through a virtual reality platform to make them feel a little different? So let's get our innovative juices flowing. I am not interested in running a nursing facility. I'm not. These people are smart. These people in our homes are tech savvy, these seniors in our independent living. We owe it to them, not just to care for them, but not to treat them like indolents. They are able to learn and they could teach us.
Nick, let us hook everybody up in your facility to the Virtual Senior Academy. We talked about that the last time we were here with Marilyn, and we have opportunities for seniors to learn every day together from each other, from other experts. Let's continue to give people the vibrant life that they deserve, that matches the life they had before and matches the contributions.
It's just the next chapter of their life. That's
Absolutely.
what it is. It's not the end.
Absolutely.
So there have been a lot of comments on this chat. We will save them, okay, and send them to both Nick and Nancy, because we don't have enough time to go through it all, and I really want to be sensitive. I mean, people are offering some suggestions. They're talking about collaboration. Obviously, there's a lot in the tech community, but for me, and the purpose of this conversation is to keep this at the forefront in terms of all the topics that we address at the Tech Council and across the tech community. This is one that needs to be highlighted, and this is one where people actually want to help. They want to help. You can see this by the chat, you can see this by the engagement, and you can hear it in what's happening in our community in terms of the actual facts, because the data in and of itself is not being shared in a way that Nancy articulated early on. And here's Nick as a lone, I don't want to call you a lone ranger because you got a lot of support, but the point is that we all care, and caring has to turn into action.
Absolutely.
So I cannot thank you both enough for spending the time with us today. As you could tell, we could have gone longer, but really appreciate it. If people want to reach out to you, is it okay if I share your emails, your contact info?
Absolutely. I welcome that.
And, I do as well.
Stay connected to us, Nick, as well. If there's anything, we're already connected to the Jewish Healthcare Foundation. We're passionate about trying to create innovation and solutions, but we need to hear it, from leaders like you. And Jonathan, I know Jonathan was here the whole time, but really appreciate Jonathan being with us, as well as the tech community. Realize that we are going to continue to have these conversations. And thank you to both of you for the work that you do.
Thank you so much for the opportunity.
Yep. Thank you, Audrey. Thank you, Jonathan.
Good stuff, everybody. Awesome conversation.